Hey everybody, it's Dr. Kadisha, your board certified emergency medicine physician, author of the best-selling book, Help Us Help You in the Emergency Room, and creator of the mobile MD kit, as well as the mini kit. And I'm here to discuss some things with you. The topic of pregnancy and the coronavirus. Okay, so I'm going to put the link to join the discussion, and I'm going to try something new. Hopefully I don't regret this, but I'm putting the link in the chat so that people can join me in the discussion. Hopefully I won't regret this. Okay, but yeah, I keep saying, I'm sorry, I'm a househead. But I keep saying, join the discussion, and you've been able to join the discussion in the comments, but I'm going to allow folks to actually call in like we did yesterday. Chelsea contributing to the live stream seemed to go over pretty well. So let's see. Hi, Victoria. Yeah, thank God it's Friday, but unfortunately for me, I have to work a 24-hour shift tomorrow. So I'm glad you're enjoying Friday, but yeah, today feels like Sunday to me instead of Friday. But I see there are 3 people in the chat. Please make yourselves known. This is all about, the information, yes, but your participation as well. I love to hear from you guys, and you see the link. So why don't we get started? So as of 3 days ago, from a sample of 12,056 women, it was found from that cohort that there were about 3,381 women hospitalized. So 3,381 women who were hospitalized. There were about 35 deaths. And who had the highest rate of pregnancy during while having COVID-19? So the highest rate was amongst the Hispanic and Latina community. Let's get this cord. Let's see. White women were second. White women had the second highest rate of pregnancy as far as like pregnant women with COVID. And Black women came in third. Black women had the third highest rate of pregnant women with the coronavirus. And let's see, after them were like multiple race or other races of people. But the very last were in the US were the Asian women, who had the lowest rate of pregnant women with COVID. So why is there a special concern with pregnant women and the coronavirus? And you'll see in some publications that amongst the more vulnerable populations, including those with, heart disease, diabetes, lung disease, things like that, you may see at the bottom of the list are women who are pregnant. And why is that? And I'll let you know. There is kind of a gray area. I'm finding that there was a gray area as far as the vulnerability of pregnant women who had the coronavirus versus the non-pregnant population. So what are some of the changes that pregnancy causes that affect the breathing of women? So it's the hormonal changes that cause the physiologic and actual physical changes that affect the breathing. So for one thing, there's a greater oxygen demand during pregnancy, and that's due to percent in the metabolic rate. It's like, yes, the woman's body is functioning for 2 people now. And so there's a 20% increase in the consumption of oxygen. Also, as pregnancy progresses, the uterus enlarges, and that's the major cause of the changes in lung volume and actually the shape of the chest wall. So the diaphragm can be moved up towards into the chest cavity as much as 5 centimeters. And 5 centimeters is about the width of a woman's hand. That's a lot. That's a lot. So that's why pregnant women may become winded more easily with exertion. So the height of the chest wall may decrease, but the front to back dimension of the chest wall may increase. So, there's some compensation there. So, so we have some anatomic changes there. And the increase in that diameter front to back increases so that we can maintain our lung capacity, the capacity of our lungs to, to hold oxygen and carbon dioxide, things like that. And luckily, there is a matter of bronchodilation for women during pregnancy as well. So that's good. So it's not totally, harmful. The changes during pregnancy. We all know people who've been pregnant, and the women become a little bit more winded, yes, but really the vital capacity and the breathing frequency don't really change that much. So there's some changes there, but not a significant amount of change. So in looking at studies and articles on pregnancy and COVID, since COVID is relatively, since it is new to us, and we have to remember to include that word novel meaning new to us, there wasn't that much evidence. It is a bit scant, but there are frequent references to a CDC study that was published in June suggesting that while pregnant women are at no greater risk of death than non-pregnant women of the same age, they may be at a somewhat greater risk of developing a severe case of the illness, as it seemed that pregnant women were more likely to need mechanical ventilation. And, is that due to the fact that, having this viral pneumonia with the, the actual anatomic changes that occur during pregnancy, does it make it harder for these women to maintain their respiratory status? Who knows? It might, and time will tell. So another thing that was found was that, again, Black and Hispanic women were found to be at a higher risk of infection than white pregnant women, which matches the general population. Now, you might want to ask, or want to know, can the coronavirus be passed to the fetus from the mother? And I heard a random report a long time ago, and I did see in print today that there was a study in France that was recently published suggesting that a newborn may have caught the coronavirus from their mother before birth by way of the placenta. So they're reporting that it has happened. So guys, yeah, definitely, speak out during the comments, add things, your experiences, concerns, things like that. So what's the consensus then? Are pregnant women at more of a risk? Should they catch the coronavirus infection? Well, it seems that while, thank goodness, they are at no greater risk of death, they may be at an increased risk of contracting a more severe illness or having a more severe or serious course in their recovery, meaning that they may be more likely to need mechanical ventilation than non-pregnant women of their age. Black and Hispanic women are at a higher risk of infection, no change from the general population, and they're the highest rate of pregnancy with COVID is amongst the Hispanic and Latino population. Second is the Caucasian population of pregnant women with the coronavirus infection, and Black people are third. Asian people are at the very last. So not so much to say, as far as, oh, well, they're, so much more vulnerable. It's kind of some good news, And I guess we will continue to watch to see if there is fetal transmission from the mother to the fetus with time. But there have been, maybe one or a couple reported cases of babies being born with the coronavirus. So does this change what OBGYNs are saying to pregnant women? And actually, in one article that I was reading, and it was one that discussed the CDC study, there was an OB-GYN by the name of Dr. Riley who said, no, it doesn't change anything. Mask wear is still important. Washing your hands, using sanitizer, and all of that is still recommended. And I have to admit, I was able to speak with OBGYN Dr. Hoden today, who said that she has noticed that, there's more crowding in the rooms of women who are expecting. More of the family members are present. And she says even in the presence of a pregnant woman, there's still an issue with mask wear. Can you believe that? She says when she walks into the room, too often she has to remind the family members to put on a mask. And sometimes when she's left the room, she's noticed them removing their masks. And masks are still advised, even on the pregnant woman while giving birth sometimes. So, so mask wear is still needed. So, if you are going to be in the hospital with a pregnant woman, definitely expect to wear a mask. She may be expected to wear a mask as well. But typically when women are admitted to the hospital for labor, they are routinely swabbed for the coronavirus. They're tested. So that's a good thing to know as well. But yeah, so pregnant women may be a little bit more vulnerable as far as having a more severe course at times, but they are at no greater of a risk in death than the non-pregnant population. And in hospitals, masks are still an issue. People are still trying not to wear masks, even around pregnant women. But there is one thing that I've noticed, and you'll be able to refer to a Facebook Live that I did in the past, and it was talking about changes that healthcare facilities are making to prevent the spread of the coronavirus. And one of those changes is limiting the number of people who can be in the room with a patient. So because of this, because crowding does lead to an increased rate of transmission, there might not be that many people allowed in the room as there were in the pre-pandemic period. So expect that not everybody may be allowed into the room. You guys are going to have to wear masks. You're going to have to use sanitizer, things like that, and still socially distance. So that's what I wanted to share with you guys today. Definitely, join me in the comments. Share your experiences, your concerns, and definitely talk about other topics that you would like me to mention. The next thing that I want to discuss, say tomorrow, it's going to be a little break from the coronavirus. We're going to talk about sprains and strains. While I'm at work, hopefully I'll get to, step outside and discuss those things. It's probably going to be around 10 p.m. Central Time, so 10 Central, 11 a.m. Eastern Time. And then Sunday, after I recover from my 24, then we can start to discuss the long-term effects of COVID, part 1. Since a lot of people want to downplay it and say it's like the flu, you might have a mild course of infection and an uneventful road to recovery, but there may be some permanent changes that other people are experiencing, people who don't fully recover right away. Now, I've read about cases of people still not having their sense of taste or smell months after they've recovered. So there are some things, you've heard about the strokes, you've heard about the blue fingers and toes in children and things like that. That is still a concern. So we're going to talk more about that. I know pregnancy might not have been like the sexiest issue, but to me, it's still a concern. Because we could still get pregnant women in the ER, and we have to know if there are any special considerations that we need to give pregnant women as well. Another thing with pregnant women is that women who are pregnant are more prone to blood clots. So that's another thing that we have to consider. Is it bacterial pneumonia? Is it the viral pneumonia of COVID or another viral pneumonia? Or is it a blood clot in the lungs? Because pregnant women are definitely vulnerable to those. So those are just some take-home messages. Thank you so much for joining me, and definitely check out my shop there so that you can get your mini kit, which will help you stay safer during this pandemic. It has mask, sanitizer, gloves, forehead thermometer strips so that you can check your temperature if, the moment you feel one coming on. And it even has ear savers in case your ears get irritated by those loops or the loops become loose. So follow me on Instagram at Dr. Khadisha MD. That's Dr._Khadisha_MD. And of course, you're already here with me on Facebook. Thank you so much for your support. And let's see. Oh, Victoria's saying that some of the patients she has to see at home during home care therapy still suffer with poor endurance levels. Let's see. Are they? And you said with tachy, is their heart rate still elevated? Is their heart rate still elevated? And you can definitely hit the link, and we can definitely discuss that. I'll put the link in the chat again if you want to discuss that. And I think I did hear that too about, people still not feeling as vital as they used to long after their recovery. Okay, so I guess, all right, so we will discuss that. Okay. All right, great. So yeah, that's another one of the long-term effects. Another one of the long-term effects is still being winded, with exertion that might have been effortless for you in the past. So we'll discuss those things on Sunday. And definitely, again, this is Dr. Khadisha, your board certified emergency medicine physician, author of Help Us Help You in the Emergency Room. It's full of tips and pictures and even a mini workbook inside to help all of us make the most out of an ER visit so that we can get in and get out with less frustration, less miscommunication, and hopefully a lower bill and a shorter length of stay. All of those things can be achieved by checking out my book. And definitely stay safe during this pandemic with the mini kit. Okay, so 3 liters of O2, Victoria was saying, so like a low oxygen saturation. Okay, so it looks like, so it looks like we're going to have a very interesting discussion on Sunday. So, but yeah, Victoria, yeah, definitely fill us in the comments. You guys enjoy your Friday evening, and I hope to see you on Saturday. Bye.